Hey guys, I love saving money. And if you don't believe me, thinking, who the heck is this guy? Here I am on a Friday afternoon using my buddy's guest membership gym pass because I'm too cheap to buy a gym membership myself. My name is Preston. I'm a board certified family nurse practitioner. And one of the top 5 biggest expense items in US households and here in 2026 is healthcare spending. It is one of the biggest line items expenditures we spend on nationwide. Well, here's 3 ways that you can save on healthcare spending. It's super simple, guys. So the top 3 ways you can save is insurance, cash pay, and taxes. So insurance, if you have an employer, get you some commercial insurance. Depends case by case. Some people benefit from it, some people may not, but you're gonna get really good care because usually these pay out the best, so you get the best coverage. But if you're over 65, Medicare Part B with a supplement, Part D if you have heavy pharmacology utilization, so you're getting a lot of medications, the traditional Part B with a supplement is definitely the way to go. Unless you don't use your benefits a whole lot, you might want to look at the Advantage plans, but generally, if you're 65 or older, you're going to use healthcare more. So definitely at least look at the traditional Part B with the supplement and the Part D for your medicines. And then lastly, we have Medicaid. Medicaid is good. It's for those that need it, but it's not going to pay out the best. Usually, if you find the money, you can find the problem. And because you're not paying the provider as much because you're using Medicaid, sometimes you can have some issues getting access and finding quality care. Not a catch-all. Again, some are super A++, but those are insurance options. Next, we have cash pay. If you're more affluent and you can afford like a concierge service or you can have direct primary care access, this is a great way to save money. In primary care, 90% of your healthcare needs statistically can be covered in the primary care setting. And for these direct primary care memberships, a lot of places are doing it for like $80-$90 a month. Now I'm here in rural Southeast Missouri, so it may be north of that there in more urban areas, but still you're south of $200 a month for really good access to care. Now there are concierge services. Those are for really wealthy individuals, and those are cream of the crop, but not everybody can afford those, and that's understandable. Last thing, if you don't have a health savings account, I really recommend looking into it. Everything that you spend on healthcare is generally tax deductible, assuming that it's done through a licensed, vetted provider. So a health savings account helps you get tax-free money. So it's pre-tax money that you're using towards your healthcare services. But even if you don't have a health savings account, save those receipts from your doctor's office, report it on your tax return, give it to your accountant, and say, hey, these were healthcare expenditures. Make sure that you write it off on those taxes. So 1, 2, 3, easy way to save money. Can't count those pennies, you won't have dollars. Preston MP out.